Afternoon, everyone, and welcome to this week's Fireside Chat. As we enter into a long weekend, we are really appreciative to have all of you with us today because we do have some important information to share related to our phase 2 of our eventual return to the workplace. I'm Lisa Stearns. I'm here with Dr. Tim Cross. We do have a special guest, and that is Dr. Marcy Souza, who will be joining us in just a few minutes. But first, a little housekeeping. Remember to keep your audio muted during the conversation. Use the chat function. If you would like to ask a question, you can post that publicly or send it to me privately. And also do remember that there is going to be a recording of this session, and it will be placed on the coronavirus website at the first of next week. So, Tim, the UT system and UT Knoxville campus have both released documents with ideas and recommendations for bringing students back to the fall and of course reopening the campus. How do these plans, in your opinion, relate to UTIA?
Great, thanks for kicking us off here once again, Lisa, and welcome everyone. Good to see all the faces from across the state, across campus with us once again today. Yeah, as Lisa mentioned, you may have seen either or both of the reports that were released last week, and actually, while those are University of Tennessee specific, there's a number of reports coming out nationally about best practices, procedures, guidance for higher education, for colleges and universities, and all of those different documents really provide some ideas, examples, recommendations to attempt to manage risk, to help us to have a safe place, particularly for our students and our faculty and staff engaged with those students. And in general, it attempts to give everyone some practices to follow that we can all have some assurance that we're doing the very best we can to manage through this crisis. As Lisa mentioned, the focus on both of those documents, I would say, even though it's not exclusively on students, it's largely on students. And if you think about a campus like the University of Tennessee, Knoxville, and bringing 29,000 plus students back to our campus in a very short period of time, obviously that takes a lot of thought, it takes a lot of preparation, and it takes a lot of planning. And that same thing can be said for all of the University of Tennessee campuses. So a lot of those documents, ideas, and so forth really pertain to being ready this fall or late this summer for that real surge in student numbers and what we can do to prepare for that. So as far as the Institute of Agriculture goes, certainly our Herbert College of Agriculture is directly involved in the student return. But if you think about our College of Veterinary Medicine, UT Extension, and Ag Research, we don't start up in the fall. We're still hard at it. And so we've got, again, a different point in time for us that are not directly involved maybe in the traditional academic programs. Nonetheless, there are some ideas still in those reports about this fall as it pertains to research, as it pertains to outreach and engagement, as it has some statements about visitors or guests to our facilities, and all of those are areas that we need to pay attention as well. So we're certainly involved with both of those efforts that resulted in reports this past week. Dr. Marcy Souza was a part of the UT System Task Force that issued the report that was led by Dr. John McCullers out at the Health Science Center. And we had several of our faculty and staff involved in the UT Knoxville's task force, which had a total of about 82 members that helped to develop that report. So we've been at the table. We've been sharing our needs, our challenges as those reports have been developed. And certainly we'll continue to stay on top of those at the system and at the Knoxville campus level as we continue to implement our own plans for the Institute of Agriculture.
So we've talked a lot about the whole idea of a phased-in approach. And as we as an organization continue to move ahead with a phased reentry, our goal is to begin phase 2 on or after May 30th. That's the date we've been talking about. So what do you think phase 2 is going to look like for us?
Good. And again, we've got several different documents that guide this. Depending on where you're located and what your responsibilities are, you may need to look at a different document. So for our off-campus folks, UT Extension and Ag Research both have documents on the UTIA coronavirus website, among other places, that describe the phases of our reentry to the workplace, and specifically spell out phase 2, obviously. And then for those on campus, the UT Knoxville plan still guides our activities here on campus. And finally, for the College of Veterinary Medicine, they're, of course, in a different situation in terms of their needs to provide hands-on training for students and their need to serve the public with regard to our animal clients. So College of Veterinary Medicine has their own guidelines and procedures that they've been sharing. But in a general sense, all of those plans for phase 2 really are not drastic changes from where we've been. It includes all of the same requirements that we've been following. And it mostly just indicates the opportunity to bring back, as necessary, additional staff to increase our capacity. But all of those plans also continue the expectation that as many of our staff as possible continue working remotely. So the majority of our folks, which, you know, if you say what's a majority, well, more than 50% are still going to be working remotely, even in phase 2. And the practices that we follow in phase 2, again, by and large, are the same as what we've had in place. We're going to continue, in fact, even emphasize more the need for daily screening, which has been in place throughout phase 1. We're also going to emphasize good hygiene practices. I keep hearing more and more that hand washing and effective hand washing just can't be done enough. So we're going to continue that expectation. And then also using appropriate personal protective equipment, and especially masks, will still be a part of our response in phase 2. And as you think about in those offices where a few more people may be on hand, all of those things really become more important because there are more opportunities for direct contact. So following good practices, making sure we're doing the screening every day, and wearing our masks when we're not in our offices really becomes even more important. So that's what phase 2 looks like. For those who are expecting it was all hands back on deck, that's not the case. And that's why this is called a phased reentry. We are not, again, flipping a switch and going from one state to another. We're gradually increasing those who are at the workplace slowly over a period of time. So that's what phase 2 will look like. And then let's also talk for just a minute about when does phase 2 happen. So in the counties, the county offices are looking at their number of cases in the county they're located in, and they need to be in touch again with their county director and their regional director to determine when is the time to move to phase 2. And so we'll have to do that on a county by county basis. The research and education centers certainly can look for guidance from the dean's office from Ag Research. And for the UT Knoxville folks, we know that phase 2 will not start prior to May 30th. So that would be the very earliest. May 30th, if you look at the calendar, is next week. So that's still at least a week off. And we'll just see what the numbers look like and what the decision campus-wide is with regard to starting phase 2.
So as we can all imagine, having to re-enter on the campus it's just a much more complicated process. And we've been establishing many recommendations and requirements as we go along. And it's really kind of challenging to understand them all. So what resources are available to us, and what will those expectations for us be?
Yeah, it's a great question. And I don't know about you. I feel like we've just had rules and procedures and guidelines coming at us from different directions, including from me, almost on a daily basis. And it gets hard to remember, what am I supposed to be doing? What do I have to remember to do? What are the requirements? Where is one place where I can get all this information? You know, you can sift through our guidelines that are on the UTIA coronavirus website. You can watch some of the past fireside chats. You can read some of the past messages. That gets very time consuming. So thankfully, our UTIA coronavirus task force took on the challenge of really trying to pull all this information together, put it in one place, if you will, and package it up for each of us so that we can have a good snapshot of what the expectations are, what the requirements are, and how we can go about doing our part with regard to reentry. That's been put together as a 15-minute video training program, and it will be available on our Kate web platform. So that very soon will be announced. Look for it early next week. And the expectation is going to be that all of us complete that training. So I know many of us kind of cringe when we hear that there's another mandatory or required training. But I think if you consider that this is about your health and safety and the health and safety of those around you, giving up 15 minutes for this, I think is really a small commitment on each of our parts. I've certainly done it. Our whole leadership team has been through the training, and I think you'll find it informative, helpful, fast-paced, and something that will be useful to you in the weeks and months ahead. So we'll be rolling that training out to everyone, as I said, early next week. But in the meantime, I'd also like to give a shout out to our UTIA task force, and particularly the lead for that task force, who has been Dr. Marcy Souza. Marcy and the whole task force itself has done a great job. And so today's special guest is our own task force leader, Dr. Marcy Souza. She's in the College of Veterinary Medicine. She directs the public health program there. She's been just a really solid, dedicated, helpful, positive leader throughout this virus. And I want to say my own personal thanks to her and the entire task force for the extra work and the extra time they've put in helping us lead. So I'd like to turn it over to Marcy now, and I think she may want to share her screen and share just a few things with you regarding how we move forward, and maybe some helpful tips and tricks to make things a little easier in the days ahead.
Thanks, Dr. Cross. I wanted to say hi to everyone out there across the state, hopefully, and hopefully we're all looking forward to our 3-day weekend ahead. I know that I am. And what I was going to do is, first of all, I'm going to share my screen, and hopefully I can pick the right one. And so what I just want to do is first thank all the other members of the task force that have really been instrumental in the various tasks that we've been dealing with since early March. And the most recent one, as Dr. Cross mentioned, is we've put together a 15-minute video that really what we're trying to do is make sure that you're, I guess, up to speed with all of the things that we want to practice as we return to our workspaces. And so not just in Knoxville, but across the state. So what are the best practices that we're going to do to keep ourselves as well as our coworkers and clients and everyone else healthy? And so that push will come out, I think, early next week. One of the things that is in that video, and we'll move on to the next one here, is most of you have probably seen some information about doing a self-screen before you actually come to your workspace every day. And so the initial is, ugh, why are we doing this? You know, I think a lot of workplaces have found, certainly in those areas that have had higher case counts, that doing a self-screen every morning before you leave your house is really important to identify maybe some subtle signs that you may actually be on the early stages of infection. And so this went out, I think, maybe earlier this week or last week. And, you know, the thing is there's not an app per se to put on your smartphone, but a couple of smart folks on campus came up with how to make this essentially an app on your phone. And so this is what it looks like if you actually go to the page. And it's got a couple of questions just asking, you know, what sort of symptoms you've had. Do you have a fever? And the thought is that you would do this every day before coming to your workspace. And I know that I would probably forget to do this. And so one way is maybe to set yourself a little reminder that before you head out of the house to go somewhere, to go ahead and do this real quickly. And the idea is that this will actually go to your supervisor. So at the bottom of it, you put your supervisor's email in. And so the question is how can we make this easier without having to navigate through your iPad or your phone or whatever it is? And so for all of you out there across the state, there's a way to make it into essentially an app, either on an Android or an iPhone. So if you got an Android, go ahead and take it out. And I'm going to walk through how to actually make it into a tile on your home screen. And so if you go to your browser and you go ahead and pull up selfscreen.utk.edu, I'll give you a second to do that. And if you're on an iPhone, you can do essentially the same thing, and I'll show you the buttons here in a minute. So once you get to that home screen, there's going to be these three little buttons up here, the three little dots. Just go ahead and click on that three-dot menu. And then you'll get this drop-down bar that says Add to Home Screen. Go ahead and click on that. And then say Add. And then it should give you a tile on your home screen. And then similarly, if you're using an iPhone, go ahead and go to your browser, open that same selfscreen.utk.edu. Go down to this little icon here. I'm not really sure what it is, but go to that little guy and click on it. And then similarly, say Add to Home Screen. And then it'll come up here and say Add again. And then voila, there it is on your home screen. And so all you do is you click on this, and it'll automatically take you to that site without having to navigate through any sort of browser. You will still have to log in and do the double authentication, but you're already on your phone, so it should be fairly simple. And then you can just go ahead and do those quick questions and enter that email for your supervisor. And that hopefully will make everyone's life just a little bit easier every morning before they go to work. And I will stop sharing there. Any questions or other further comments you'd like me to make, Dr. Cross?
You've covered it well, Marcy. We're gonna, maybe shift you over and become an IT specialist.
No, that's not a good idea. Not a good idea.
Well, thanks. I hate things that I have to remember to go do every day when they're not easy to do. So I think for each of us, being reminded of answering these questions is important. And it actually triggers an email to your supervisor saying, you are now screened and healthy to come to the office. That is all that goes to your supervisor. The answers to those specific questions do not. So it's an easy way to get this done daily, and for your coworkers then who may be at the office to have faith that we've all screened ourselves and that we're all in a health status that doesn't put others at risk. So good tips there to make this easy, and anything we can do to make things more easy and more streamlined at this point is certainly helpful. So that self-screening will also be described in the training. That's part of the content, as well as other aspects of what we need to be doing as we re-enter the workplace. So the 15-minute video will cover that and more, and watch for that again early next week.
And Marcy, did you want to make just a few comments about the training, the contents of the training, and the importance of going through that?
Sure. This was a training that was originally put together by the UT Health Science Center as a way to make sure that everyone that was coming back into their workspaces were aware of, what their actual risk was in terms of contracting the disease. And so when you think about most folks that are on this call compared to someone that's working in a human hospital, our risk is going to be quite a bit lower. But that's one of the things that it addresses is what is your risk relative to who you're being exposed to, but also in terms of your own personal health for developing those more severe disease. And then the other thing that it really focuses on are the steps that we want everyone to think about as they return to those workspaces. So what are those personal habits that you can do to help keep you safe, as well as your coworkers and colleagues that are going to be sharing space with you. So it's pretty pain-free. Fortunately, you don't have to listen to me most of the time. It's Dr. Lisa Washburn, and who I think her voice is much better than mine, but I think most of us always hate our own voice. But so she actually did most of the narration, and there's a few questions at the end, but as long as you're paying attention, you'll be fine.
And for those who didn't see, Marcy will provide us that PowerPoint, and we can distribute that so that everyone can have the instructions on how to bookmark those on your phone. So great, thank you so much. So remember, if you have questions, to be able to post them in the chat. We do have one, Dr. Cross, and the question is, what is the status of the extension conference scheduled for November? Would that type of event still be on?
Great question. And at this point, November seems like a century from now, doesn't it? On the other hand, if we're not planning for it, it's going to be here before we know it. Right now, our guidance only carries us through July 31. In terms of no longer having public meetings, public events, large gatherings. I expect that we'll continue to follow CDC guidance, and I believe the next logical step for the CDC guidance is going to be expanding the ability to hold public meetings of up to 50, and then perhaps the next step beyond that might be 100, and perhaps the next step beyond that may be no restrictions. When those milestones are achieved is still a huge question mark. So really difficult to determine what November holds for us at this point. I know I continue to be asked both within University of Tennessee and externally from other groups, what should we do about the fall, about the winter, about the spring? I think it's really challenging to provide concrete guidance at this time. So I guess my opinion is it wouldn't hurt to continue planning, but it also wouldn't hurt to have a plan B and to see how things play out throughout this summer. I know hotel contracts and convention center contracts and other kinds of commitments with facilities, that doesn't work too well. They expect an answer today, or they already have a contract in place. So that certainly provides a challenge. The organizations that I'm involved with that have those kinds of agreements, in most cases, those facilities are at this time not willing to cancel without a penalty, but they are willing perhaps to reschedule, to postpone, as opposed to canceling, again, in most cases. So that might be something to consider if it needs absolute certainty today. That's probably the avenue to explore. If we can wait just a little longer to make a final decision, that's probably another option as well. I wish I could say for sure what we could do in November, but we're just not at that point yet.
So along the lines of conferences, someone is asking if can people start registering and paying registrations for out-of-state conferences that might be held in the fall?
So again, I think our guidelines right now say, we're restricting that until July 31, which implies starting in August, then there are not restrictions. And I don't see that changing at this point. In other words, I don't see extending that any further at this point. But I think our guidance also says try to wait as long as you can before making those commitments, because if something were to happen and we were to see a big surge in numbers that would require us to further restrict out-of-state travel, then we're obviously going to be incurring costs for having made travel plans and then canceling those plans. So I think, again, not knowing what the future holds and not knowing what those travel commitments might be and what the planners of those events might be thinking, if wouldn't hurt to put a reminder on your calendar or hold the date on your calendar, and it wouldn't hurt to register if it's not a huge financial commitment, but I would hold off on airline arrangements certainly till later in the summer. And if possible, I wouldn't make huge financial commitments until later in the summer as well.
So here's a question for you. With everyone on different time schedules, some county offices in phase 2, some not necessarily in phase 2 at this point, will there be a place where people can go to find out what phase a county office is in, or should everyone just reach out to their county director and work through it county by county that way?
I know that there's been talk and discussion about having a heat map or an interactive map that would show county extension office status. I don't believe that's been activated since we went to a remote working status, but as we enter phase 2, the county offices will be open to the public again, and so that will be, I think, important to make that service active once more. I'll need to follow up with Dr. Burns and see what the extension administrative team has in mind with regard to providing that information. Meantime, I know if you go to the extension coronavirus page, it has the county map and county directory there, and it's easy to click on a county and certainly find their contact information, including a phone number, and give them a ring to find out if they're open or not. Again, it'd be even more helpful to be able to glance and see what the status is visually for those of us who interact with more than one office. So I think I'll follow up with Dr. Burns and his team. Don't think Dr. Burns was able to join us today, but we'll be sure we have some information on that. Let's see who may be with us. See, Dr. Buschermole's on. Mike, do you have any information about status for our county offices? And Mike Stanley, you may have to enable Mike Buschermole's mic. I see he's live now. Mike?
Can you hear me?
We can hear you, Dr. Buschermole. Thanks.
Okay, good afternoon. I know each week that the Extension Administration team meets with the regional directors, and this past Wednesday, we kind of get an update on where the counties are, which ones have gone to the next phase. And so I think it's a good idea that we put together the map like you talked about, and I'll bring that up to Dr. Burns later on this afternoon when I talk to him.
Great. Thank you, Dr. Buschermole.
I know Tammy McKinley was very helpful in getting the first map put together.
Good. Yeah, as we were phasing down, offices were closing here and there, but then they all closed. So it was pretty easy to show the map when they were all closed. Now we're phasing up again. So, and I think Tammy already said we can make it happen. So
I saw that, and I know that all the regional directors are keeping, a spreadsheet, I think is what they're using. So we can make it happen.
Good deal. Thanks. And thanks, Jerry Lamb, for chiming in on that. Appreciate it.
Okay, so here's a question, another one for you on events and the whole idea of social distancing. So is there a feel if social distancing is going to be a requirement for future events or meetings after July 31st? Because this person has observed that it's a challenge in large events, that even in a recently opened public area, it's been observed that it's hard to document from the ground and floor, like what is actually a 6-foot difference.
Yeah, boy, it's a real challenge. And I think it is likely to be a continuing challenge, particularly if it's an event that puts a larger group of people in a confined space for a long period of time. I think we've all had experiences of going to the grocery store, right? And there's more than 10 people in the grocery store at any point in time, but we're not standing or in close proximity to any one of them for an extended period of time. Whereas many of our events, if it's a classroom setting or even a meeting type setting, we're looking at prolonged periods of time where we are within fairly close proximity. So I think we are going to have an expectation of continued social distancing in situations like that going into the fall, and that applies on campus as well. So if you looked at some of the plans that we referenced earlier today, they all talk about ensuring that we don't have students sitting side by side in the classroom, for example. So I think the same is going to apply to our meetings and events. But I also realize, that's easier said than done. Think about a livestock show, for example. It's not a classroom setting, it's not a meeting setting, but it's a lot of people milling around. And how are you going to enforce or impose a 6-foot requirement at any point in time? It's just going to come down to individuals choosing to behave as we all hope we behave. And I think it also may well come down to if we adopt and use masks regularly, that will certainly help. Again, it doesn't prevent the spread, but it helps protect others if you should be asymptomatic, but a positive case, for example. So we're still going to have to follow best practices, even as we see possibly scaling up the size of events that can occur.
So someone else has asked about phase 2, and does phase 2 mean that 4-H specifically can start having face-to-face meetings or events?
Yeah, now my expectation would be that we're still limited to audiences of 10 or less for gatherings of any kind, whether it's internal meetings or external meetings, but that up to 10 individuals is possible. So it depends what we mean then by face-to-face, whether it's 4-H, agriculture, any other topic area. So we're still limited to organizing meetings or events to 10 or less at this point. Let me just invite Marcy if she wants to comment on either of those two responses. Anything to add or correct there, Marcy?
Mike moved away. Yeah, so I think that we're probably going to have to still be pretty conservative through the summer in terms of numbers. And I think that one thing that we've been emphasizing to our veterinary students as they come back, because they're starting to come back here in the next week and a half, is that we're not really just looking at the summer, that we need to see this as the long haul, that we don't have a vaccine, we still don't have a treatment. And so we need to think about this in terms of the next, honestly, academic year. So we need to follow those CDC recommendations and try and keep our numbers as small as possible and keep social distancing.
Thanks, Marcy.
Mm-hmm.
We're just full of cheery information today, aren't we?
I showed them how to make an app. That's at least fun.
You did your part.
And someone did share that a jump rope is actually 6 feet. So that could give you at least a visual of how far away that might be.
Great example. Thank you.
Well, looks like that's it. Everybody, I think, is really excited about a 3-day weekend. So, so Dr. Cross, any final thoughts you'd like to share, especially as we do enter into this Memorial Day?
Yeah, good. Thank you, Lisa. And let me catch a couple of things I did see on the chat as we were talking. One was a special shout out to Sophie Schmidt, who has really been a great help with our website, the contents of our website, posting the chats and so forth. And the task force has provided her a lot of that information, but Sophie's brought it live for us. So I also want to say thanks to Sophie. I see Dr. Claudia Kirk says the governor approved 55 individuals starting next week. So I think, that's something to watch. But again, think about that being statewide, but not necessarily mandatory anywhere, I don't believe. So the university will probably be more conservative than that for the time being. Certainly on campus, we will be more conservative than that. I think off campus, Dr. Burns and the extension administrative team feel like things have gotten to where it is possible to open up to larger groups. We could consider that, but let's also think about our responsibility in terms of modeling behavior and in terms of protecting the health and safety of ourselves and those we serve. And remember, that was priority number one. going into this pandemic, is we're going to take care of ourselves and we're going to take care of others. So even though it may be tempting to say, you know, the coast is clear, everybody just come back and let's have a meeting of 60 or 70 people, think about the ramifications of that happening and then a large outbreak occurring, and how that would impact our programs and how it would impact the university in the future. So I'm, like you, very anxious to be with people again, to be able to interact with groups, to be able to teach, to be able to learn in group settings. But I also, like Marcy said, feel like, you know, we're in this for the long haul. The new normal is going to be different, and so we've got to be careful and not let our guard down just yet. And actually, that was one of the comments I was going to make to wrap up is, you know, we are moving to phase 2, but let's not give up just yet and say, okay, everything's back the way it was. We need to remain diligent. We need to stick with wearing masks. We need to keep washing our hands. We need to stick with the distancing, the jump rope distance for the foreseeable future. And as Marcy mentioned, mostly we need to go home and really enjoy a nice 3-day Memorial holiday, honor our veterans, enjoy some time with family and friends, small groups, and take a little bit of time away from coronavirus if at all possible. Thanks to every one of you for what you continue to do. I continue to get positive feedback about how we're helping on campus and across the state. And your hard work, your dedication is still recognized and appreciated.
Great. Well, thanks, Dr. Cross. And another nice visual is 6 feet is about the length of a cow. So there you go. So thanks, everyone. We appreciate you being with us, and have a wonderful 3 days off.